Hello, everybody. This is Dr. Al Ewer, Fellow in the American Association for Respiratory Care, co-editor of the Egan's Fundamentals of Respiratory Care textbook, as well as two other textbooks, professor at Rutgers University. But I'm coming to you today in another role as co-owner of A&T Lectures to tell you about a very exciting event that we have. It's virtual, and it will be on October 22nd from 4 p.m. until 9 p.m. Eastern Standard Time. The event is focused specifically on sleep medicine and includes one session related to a clinician's guide to CPAP adherence. We really hope that you all will come. Studies show that patients having obstructive sleep apnea, or OSA, typically go undiagnosed for up to 10 years with steadily declining health and increased use of healthcare resources. This is a very undesirable combination, but there's things that can be done to improve this situation. These strategies will be discussed in this CEU event. CPAP adherence is challenging, but it's possible. CPAP is almost 100% effective when used regularly, but adherence is challenging. Up to 50% of obstructive sleep apnea patients reject their CPAP within the first week. This is really problematic because if they are not compliant with CPAP, untreated obstructive sleep apnea often results in very serious health consequences, such as hypertension, depression, diabetes, dysrhythmias, and more. This presentation, however, covers strategies for maximizing adherence to CPAP, thus enhancing the patient's health status and reducing the burden they place on our healthcare system. To help increase your knowledge in sleep medicine, as well as strategies to enhance adherence to CPAP therapy, A&T Lectures again is offering the CEU virtual event focused on sleep medicine. It's on October 22nd from 4 p.m. till 9 p.m. Eastern Standard Time. 5 CEUs for a mere $30, an excellent value. To register, visit our website overall, which is www.atrespiratorylectures.com, or you can specifically go to the link here that focuses on the event itself. We really hope that you come to this event. We thank you, and we hope you have a wonderful day.